Well, good morning, good afternoon, good evening, wherever you are joining us for session 15 of a most important Congress. Our session is titled Harnessing the Media to Advance the Global Fight Against Sepsis. And that's precisely what I've been doing for the last few years. My whole career has been in the media. I'm currently the chairman of the big communications regulator here in the UK, but I've chaired the BBC and all kinds of things in my long career, too long, really. My secretary got sepsis and she was off for a long time, and she eventually came into the office back to work. I said, "What? You only had an appendix. Why have you been away so long?" She said, "I had sepsis." I said, "What's that?" And that started the journey. We put together a team of people to advise the Sepsis Trust here with the aim of creating awareness. And I used my media skills and experience, and we've had really good success here in the UK through the media, through Parliament. I sit in the House of Lords, so I'm able to raise the issue with the government through the House of Lords. But most importantly, we've been getting the message out through events, but mostly through attracting people who've had tragedy in their lives through sepsis, many of them very, very famous people here in the UK, and they've joined us, and they're very generous in their time, telling their story to corporates, to newspapers. There was a huge primetime documentary by one of our people, a big star here in the UK, an actor who had lost his daughter to sepsis when she was 2 or 3 years old. And we have begun to move the dial in terms of awareness. And in the UK, the awareness is the most important thing, not just for potential sufferers from sepsis, patients, but clinicians, because one of the great problems here in the UK is that the clinical diagnosis is very, very erratic. And there are too many deaths. It's one of the biggest killers here in the UK. Many of the deaths unnecessary because the protocols in the hospitals and the doctors' surgeries are not up to snuff. So we've been working incredibly hard, pushing the message. Could it be sepsis is the kind of slogan that we've been pushing everywhere. And it's going very, very well. So I think this panel really is to hear the experience from some very, very distinguished experts in this area. I'm the least distinguished of the panel, and they're going to share their experiences. I'll introduce them as they speak, as they begin to speak, and then we will have a discussion, and we hope you will join in with questions, which I will attempt to get answered by this marvelous, marvelous panel. So we all care deeply about sepsis. It was brought home to us a few minutes ago when I heard that John Burgess, an Australian expert who was going to join us, is unable to join us this evening or this afternoon or this morning because his wife has been stricken with sepsis, which is a horrible, horrible irony. But we hope she's well, and we wish him and his wife well. But hopefully he's in a position to have recognized it early enough to deal with it. So our first most distinguished panelist this evening is Katelyn Jetelina, who's an epidemiologist, data scientist, internationally renowned scientific communicator. She's the director of Population Health Analytics, a non-profit, non-partisan health policy think tank. She's had endless awards. I could go on for hours describing the heights that she's reached in her career, and we're very, very grateful to you, Katelyn, for joining us this evening and sharing some wisdom on this topic of how we get the message out there. Over to you, Katelyn.
Yeah, thank you for having me. Like Michael said, good afternoon, good morning, good night, wherever you are. I'm Katelyn Jetelina. I'm an epidemiologist here in sunny Southern California, as you can tell from my background. But I have been at the forefront of the epidemiological response during the pandemic, and also the desperate gap of scientific communication over the past 3 years. Early in the pandemic, so March 2020, at least here in the States, it was early, I started a newsletter that translated public health science so the average layman could make evidence-based decisions. So really created a direct line from scientists to community. And this platform grew and grew and grew over the past 3 years. It's reached over 330 million people in 130 countries. And although I'm mostly focused on COVID-19 the past 3 years, I think that the lessons learned can really be applied to any health outcome, including sepsis. And during my time exploring this new space, I have seen the good, the bad, and the ugly in this space as well. And I think some lessons can be applied to the sepsis community. And really, my buckets, I think about this is one, the importance of trusted messengers, like Michael said, leveraging healthcare professionals that are trusted voices that can help patients and the community digest information, craft messages, and help guide evidence-based decision making. The second I think we can really learn about is social listening. So listening instead of hearing, to address concerns from a place of empathy and directly addressing those concerns rather than telling people what we think their concerns should be. Three, when and where to combat mis and disinformation, given this rapidly evolving information ecosystem we're seeing across the globe. And so I really hope that we can get into some of these topics throughout this session, but thank you for having me. I'm very excited to be here.
Thank you very much, Katelyn. I'm now going to ask Joachim Mueller-Jung. I hope I pronounced that right. It's a long time since I did German at school, but I've done my very, very best. But as you can see, ladies and gentlemen, this is an extraordinarily international panel. And Joachim was born in Heidelberg. After graduating from the Wirtschaftsgymnasium Wiesloch and taking his first steps as a freelance journalist, he began studying biology, which he continued in Cologne, completed with a thesis on the reptile fauna of Madagascar. Well, there you go. So what are you doing now, Joachim, and how do you relate to sepsis?
Yes, thank you very much, Michael. I'm really happy to be here, and thank you very much for the invitation. So I am right now, I'm a science editor here at the Frankfurter Allgemeine Zeitung, which is one of the national newspapers. It's a daily and a weekly newspaper. And of course, we have an online platform. And as a science editor, I was at the forefront of the science of the COVID pandemic coverage for our newspapers. As Katelyn, maybe she had much more readers because she's an epidemiologist and she's English speaking. So in German, we had got a lot of experience. Also, as journalists and as media people, covering infectious diseases during the pandemic, of course. And I checked our archive. We really have at the FAZ a big, large archive, and I checked it for sepsis. And I will tell you some of my experiences. We even during the pandemic, we had very few articles in Germany about sepsis, and that is really a shame, I have to say. I think for journalists, it's still a tricky topic, and it's not easy to convince journalists to write about sepsis. I think whereas some colleagues picked up the disease or the topic of bacteria in infections. They didn't write and talk about sepsis as a central theme, as a central topic. So I would say most of the problem here is that it's more about mentioning sepsis as a disease or as a complication of diseases than real education. We have no education. I think that's a real problem. So as I mentioned it, even during the pandemic. So the awareness is still underdeveloped in the general population and also in the journalism. So my task was to talk about targeted specific audience for improved medical messaging. And I would say, yeah, it's really hard to get any progress. We have got some progress since the work of the Global Sepsis Alliance. There were some articles, and we got some progress here. But of course, we have to get sepsis more popular, and I would prefer to have it more on the social media. We should use more of the social media, and I would compare it with cases like long COVID diseases or chronic fatigue disease, where a lot of people are advocating and discussing the problems with these diseases on social media, and I think that brought some progress, especially in Germany, in the political realm. So the online platforms are very important. That is my message. And of course, I would say the first people who should be sensibilized, of course, are journalists, but they should be sensibilized also by, and media experts, of course, by physicians. I think there is the physicians, they really have the professional people working in medicine, in the epidemiology and infectious disease field. They really have, I think, a big responsibility to sensibilize journalists.
Very good. Thank you, Joachim. I'll come back to you at the end of the formal presentations. We now move to Japan, to Naoyuki Matsuda, who is a board member of the Global Sepsis Alliance, the Japanese Society of Intensive Care Medicine, and a representative of the Japanese Sepsis Alliance. He has led emergency medicine and critical care in Hokkaido University and Kyoto University, currently working as a professor of emergency and critical care medicine at Nagoya University in Japan. Naoyuki, welcome and thank you for sharing your knowledge and experience with this global audience. Over to you, sir.
Yeah, thank you very much. I am a board member in GSA and now working in Nagoya University, Japan. My career, I am an intensive care physician, emergency physician, and anesthesiologist. When I was a medical intern, I had an experience of not being able to save a patient's life due to sepsis caused by mediastinitis after esophageal surgery, esophageal cancer. At first, when we should know is that infection comes as secondary stimuli in operative phases, cancer, stroke, acute myocardial infarction, heart failure, diabetes mellitus, and elderly person, newborn, result in systemic inflammation and organ dysfunction. Maybe, as you know, infection becomes infectious disease only when symptoms appear. If the symptom is progression of organ damages and organ injury, it is quite serious because it is life-threatening and life will be shortened as sepsis. However, if there is a big disease name, such as cancer, even if the patient died from sepsis, a big disease name will be the cause of death, such as cancer. Such knowledge, this knowledge may not be understood without experience suffering from sepsis or managing sepsis or treating sepsis. When I first approached the mass media about TV program, radio program of special feature on sepsis, they told that not everyone knew about sepsis, so the audience rating would not increase. If there is no need, it is not be picked up as a TV program. Today's theme, harnessing the media to advance the global fight against sepsis. Sorry. Now, this thing is very important in the world, I think. I think there are some important things to consider. Continuing education lecture for citizens. We have City Park seminar in Japan. Event folding, including World Sepsis Day. And if we can making a movie, making songs, making animation for sepsis, we will make septic character sponsors and donations. There are sponsors to raise awareness of sepsis. It is very important, I think. If there is a good way to get the mass media on our side, please let me know today. I'd like to consider this as the Pacific Alliance and the Global Sepsis Alliance. I'm very much looking forward to hear from all of you today. Thank you very much.
Thank you very much. Thank you. We'll come back to you, I'm sure, in the discussion. I'm delighted to welcome next Ms. Forgwe, who has joined us. Hello, Ms. Forgwe. Please give our audience, our global audience, a sense of your interest in sepsis and your expertise. Your skills, I know, are very much in the digital world, and perhaps you could share some experience with you. I know you're helping one of the hospitals in Cameroon, but be very, very interested to get your particular expertise on the subject. Over to you, Nick.
So basically, I'm not a health expert. I am a journalist. And I'm a journalist not just talking about sepsis. I focus more on health-related issues, not just about sepsis, cardiovascular diseases, sepsis, everything that concerns the health. That's what I focus on. So my latest research on sepsis, I noticed that about 15% of Cameroonians are septic. And the funny thing about it is that many of them are not aware that this is the condition they are facing. So I think creating awareness by using the media as a major platform or a tool to help sensitize these Cameroonians about what sepsis is really all about. And equally, why not going right to the suburbs? Most of these people in the suburbs, they don't have these social media platforms which we have. Some are unable to have, can't afford these TV stations, though some have, but very few. Why not sending health officials to the suburbs to sensitize these people on what sepsis is all about and how we can equally better prevent the situation, and equally for these people to understand that sepsis could be deadly, but if controlled, if prevented, then they have a possibility of living a very good life even with such a condition.
For those people who don't have access to social media, how on earth do you get the message out to them about the awareness and to be careful to look out for sepsis and to take care of it?
Exactly. Reason why I said we need sensitization campaigns, not just on social media, on TV stations, but going down to the roots, going to where they live, telling them about sepsis, making them aware of what sepsis really is. The funny thing is, just very few people have been diagnosed with sepsis. That's the major problem now. We talk about sepsis, just those, let's say, those in the city who have access to hospitals. Let's talk about the suburbs. Do you know some people have to cover about, let's say, 10 kilometers just to have access to some hospitals in Cameroon? That's about those in the suburbs. How then are they diagnosed? That's a major problem. If we have people on the ground, let's just say for some few, we can take in a year or maybe in 6 months, would send some people on the ground to like do a diagnosis. This will go a long way to help not just a few Cameroonians, but a greater proportion of Cameroonians who are in dire need of help.
But how do you reach into the suburbs? How do you get the message to them?
That's by sending some health workers to that part of Cameroon.
Okay. And is it effective?
Not really effective. Not really effective. But I guess they are trying their best. They are trying their best to help these people who really need health services. Because you say good health entails good body.
Very good. We'll come back to you. Pedmia, welcome. Sir. I hope I've said that right, Pedmia.
That's right. That's my name.
Hi. And your surname is?
Shatu.
Pedmia Shatu. Tell us a little bit about your interest in sepsis.
All right. Thank you very much. Just like my sister Forgwe has already said, it's sepsis for us here. It's not like, I think that it came to us like COVID-19 came to us. The awareness is not really there and the myth is there. Now, how do we get it known first? Because if they don't know it, they wouldn't even adhere to treatment. So how do we even get it known as media practitioners and let the population to create awareness and sensitization for the local man on the streets? Now, for us who are maybe learned, we can Google it and have enough knowledge about it. But what about the local man who is on the street? How do they understand it? Now, I heard you asking Ning how they were going to get it right down to the local man. Now, I think that it is very important to use the language that they understand best and also to use the environment that is more suitable for them. Because if we do not use these things, the language must be appealing for them to understand, and the environment must be very suiting. It must be persuasive also for them to know that this is a health condition and you must accept it just like every other disease, just like HIV and AIDS, just like coronavirus, just like malaria. You must first of all accept it, that this is what is happening to me, before a doctor can even go ahead to prescribe. If they prescribe without you even accepting, it will stay in their books and they will never get the medications. Yeah. Now, if they don't get the medications, it must deteriorate. It cannot just stay at that level. It must deteriorate. And I think that I lost somebody due to sepsis, and we were still in denial until the last day. Now, I must convince my family that this is the health condition my elder brother was into, until the last day when we got into theater and they had to operate his leg. He was diabetic, he was hypertensive, and we had to operate the leg, his left thigh, yes, and he still passed on. Now we had to take upon this, I had to take upon this as a media practitioner to get this across to many Cameroonians. She rightly said it, Cameroonians are not aware of it. And what they will only do will be rumors. They will stick onto rumors if the media is not there to sensitize them on the right information. I think that it is for that reason that we as communicators are brought on such a platform to give our own quota and see how we could make this sensitization go further.
Thank you. I've got a message from one of our viewers, one of our participants, who says usually, I don't know who it's from or where they are, but they say usually, this particularly relates to the Cameroonian members of the panel, usually you can meet with community leaders and organize village and church meetings to get to the rural populations. Do you agree with that?
I agree. Now, not just for health communication, for every other communication, be it digital literacy, which dives towards health communication, because if they're not digitally literate, they cannot even go as far as researching, just like Ning said that they could go on social media. Now, they must be digitally literate. Now, what do? We get down to the communities. Who holds the meetings for us? It is the people that they know that will easily call them and they gather to listen to you.
Yes.
So getting down to community leaders is very important, and it's pertinent for such conversations, because you cannot go into a community and you just start talking. You barely have 2 or 3 people to listen to you. But if they are rulers, if they are leaders, bring them together and tell them that this is a health concern. We want you to listen to it, because these are the advantages. If you listen to it, it will prevent you from A, B, C, D. They will be very much available to listen.
Very good.
I think Ning has something to contribute.
Ning, did you want to come in?
I think she has said almost everything, but
Okay.
yeah, she has said almost everything.
Okay. I think there are two constituencies, 2 stakeholders here. One is the clinical population, the doctors, the nurses, and so on. Then there are the patients. And the hardest part is reaching the patients and reaching people. And that takes PR skills, journalistic skills, and all the dark arts of journalism, which doesn't come easily, I'm sure, to people who've been trained in the medical profession. But you have to, what we've done in the UK is we've recruited a few people with tremendous communication skills and an advertising agency who work for us for nothing to create the campaign and so on and so on. There's some very big, believe it or not, in the UK, there are still some very popular soap operas on television and radio. And we've had storylines in all of those hugely popular soap operas around sepsis, around people getting sepsis and not recognizing it and so on. And that's it's got people asking questions. What's sepsis? Oh, I see. Oh, really? Oh, and those kinds of techniques are really important. I'm going to ask Joachim, and then I want to talk about getting awareness, what the level of awareness is in the clinical fraternity. But Joachim, does that make sense to you? I mean, we've used the celebrity culture very successfully. Sadly, there are many very famous people in the UK, sports people, show business and television stars, who sadly have been touched by sepsis, who are determined to get the message out there. And that's worked very well, certainly with the newspapers and the media here in the UK. Is that the same in Germany or not?
No, I guess not. I think, Michael, it's you were very successful, as I learned also from the talks in this World Congress of Sepsis, that you were already in UK. You were already very successful in conveying the subject to the people and to the physicians, to the medical people, to the professionals. You pushed every button there, how Melissa explained us. So pushing every button is very important, but the problem begins really, for me, the problem begins with the word sepsis. People really come into the clinics or they are confronted with the word sepsis, and they don't know what to do with it. They don't know what it means really. And what you said, we have to communicate the message, the right message. What is the message if you don't even know the word and the meaning of a word? It's very hard for them. So this is a really tough task, and of course, I think the medical people, the professionals, they really have a responsibility to convey some sort of narratives about the tragedy, about cases of sepsis, about really the complications people can be confronted when they suffer from sepsis. We know now, after the pandemic, we know a lot about infectious disease, but of course, nobody out there, even in the clinic, I guess there are a lot of people. I'm pretty pessimistic here. Even in the clinics and of course in the general public, don't connect infectious diseases to sepsis. That would be my guess.
Yeah. Now, making the connection to the clinical profession, many of the stories that have come to us in the UK are tragic stories of sepsis not being recognized when the sick child or the sick adult has gone to the general practitioner doctor, who's sent them away with some paracetamol. They've come back feeling worse. They've gone to A&E. A&E have given them some antibiotics, mild antibiotics. They've been sent home, and it's not recognized. I was going to ask Katelyn and then Naoyuki whether that's a problem in your countries or not. The recognition and the protocols within hospitals and doctors' surgeries, that it's the recognition, the early recognition of sepsis, which is important, whether that's adequate or hopeless.
I am not an expert in sepsis in the United States, so I'm not sure, but I could assume that primary prevention in all types of health outcomes is a major issue in the United States, particularly because of our fragmented healthcare system and a number of disparities in just getting primary care. And so I can imagine that there are significant disparities of late onset sepsis coming to an emergency department just for that reason. I also wanted to make a quick comment on before that, I think there were some really good points taken in that, it's not just influencers that have influence in a community around health messages. Some of the best trusted messengers is family and friends and physicians and health departments. And we saw that throughout the pandemic, that the best information wasn't coming from an ivory tower, it was coming from neighbors. And I think we can learn a lot of lessons from that. I think the second thing I wanted to say was that someone said, no one knows what sepsis is, a layman, and they're right. We need to do a whole lot better at translating words to plain English. And that's really or plain language, sorry. And that's really hard for scientists and clinicians to do because it's a true art form between balancing nuance with readability or understandability. And we need to get better at doing that, period.
Yes, absolutely. Naoyuki, forgive me, my pronunciation is not very good. Please forgive me. I'm very interested to understand from a practicing emergency doctor whether you think in Japan the early recognition by the doctors and the nurses of the potential that it might be sepsis when a patient is there good recognition in Japan, or is it very sticky?
Thank you very much. Japan is maybe blessing, and the ambulance arrives in 5 minutes, within 5 minutes, and the hospital arrival within 5 minutes. Now, in Nagoya area, in my university area, have acute medical patient, about 120,000 per year, every year. However, ambulance is very quickly access the patient home and bring the patient to our hospitals. Now the ambulance member, emergency medical teams are aware and know quick SOFA score. Maybe as you know, quick SOFA score, bad consciousness, altered consciousness, and respiratory rate counting, and blood pressure measurement. Ambulance member, emergency medical teams know adequately the check quick SOFA. They tell me quick SOFA over 2 and infectious suspected patient. Maybe this patient will be sepsis. Can you take and manage this patient today, this time? Okay, this is okay. Very, very quick finding.
So
This is
what
very
what
happy.
what you're saying is that that when somebody's ill, the front line, the paramedics, the front line, they are trained to look for sepsis.
Yes.
And is that general in Japan, or is that just because of your influence in your hospital?
No, totally in Japan.
Wow.
Medical education is developed for emergency medical teams, ambulance members. They suspect infection and sepsis. Nowadays,
Are there cases in Japan where people die as a result of sepsis which was not diagnosed in the hospital?
Yes.
It does happen. Why is that, do you think?
Maybe acute patient, vital sign patient, ambulance member, the patient bring to high level emergency department. However, some area there are few emergency medical centers. In this area, maybe sepsis finding will be delayed. However, totally a very, very quick awareness. However, the future of Japan, there are a few number of ICU. ICU bed number is very low. Emergency room adequate number. ICU, the number of ICU is low. ICU specialists, intensivists, there are few specialists in the area of intensive care. This is one big problem for the special management of sepsis and septic shock.
Do you find patients asking you if it could be sepsis when they come in not feeling well? Are they aware? Do they have a knowledge that it could be? Are they prompting you? Do you think this could be sepsis?
Sorry. Yes.
You do have patients who come in, and before you've looked at them and examined them, they say to you, "Doctor, do you think this could be sepsis?" Are the patients aware that sepsis is a possibility? They do.
Sepsis possibility.
In the patients, the people who are ill when they come to you, do they think to ask if it's sepsis?
Infectious symptom finding is firstly very, very important. The patient have cough or back pain, abdominal pain. Infectious symptom finding is at first, it's very important, we think. Next is symptoms, fever, low temperature. However, we emphasize quick SOFA score checking, altered consciousness.
Yes.
And respiratory rate high respiratory rate, and blood pressure, systolic blood pressure lowering. These checking is.
Forgive me, it'd be interesting to understand just in a few words what the health system is in Japan. Is it like the British National Health Service, or is it private, or is it insurance? How does it work in Japan, health?
Sorry.
Okay, no problem.
Hear you.
In Japan, how do people pay for health? Or does the government pay?
About 10% pay 90% insurance.
Okay, okay. But the analogy I always draw, and I'm going to ask anybody on the panel to respond whether you think this is rubbish or not, but the thing I say to people is we want to get the awareness of sepsis to the level of people's parents' awareness of meningitis. You know, when your kid gets a fever, most people go, oh my God, I better keep an eye on this because it could be meningitis. And people have that instinctive awareness of it. And we want to get sepsis to that point where people feel really ill. Just sepsis was described to me by our expert, Ron Daniels. He said, you know, you've got sepsis because you feel like you're going to die. It's the worst you've ever felt in your life. And he said, that's when you know you've got sepsis, which is a pretty good basic way to describe it, I understand. But creating awareness, I mean, let me ask Pedmia, when did you first become aware of sepsis as a threat, as a health threat? How did you become aware of it on a personal level?
Last year.
Really?
Actually, yes, last year, because I had someone who was attacked and diagnosed of it, and that was at my workplace, at the regional hospital. That was when I got to know it, and I started digging deep to know exactly how us as media persons, because whenever I come across a situation, I want to know how the media can help.
Yes.
Today we were launching the universal health coverage for the region, and everything centers around the media, because there is freedom of expression, as we will say, for the journalist, but how do we get other people express themselves also? That's when I knew about it, and I tried to.
When you look back, are you now shocked that you're still very, very young, but nevertheless, you're past school age, and it was only a year ago that you learned about sepsis? That really encapsulates the problem that we're trying to attack. Does that shock you now? Now you know about it, and you know how serious it is.
Yes, I know about it, and I know how serious it is. That is why I think that there are more strategic ways we can communicate this. The reason for which I wanted to be on this platform to share my experience, because I've had also an experience with the COVID-19 and how we went about it with Fondation Hirondelle, who was part of the funding, I was part of the team that worked on several programs to make sure that the population was aware of the COVID-19 and all that has to do with it, because it came like a blow to us, particularly at the regional hospital Bamenda, where I presently work. Now you would have audio circulate to tell you that don't go to the hospital. The doctors are injecting people with strange injections, and they're killing people they're injecting people with the virus. Don't go there. Now consultation drastically reduced, and we discovered that we had more community deaths and deaths upon arrival at the hospital. So this made it now, I started thinking, as a health communicator for the hospital, what can we do?
Yes.
So that's the reason why I am here to share such strategic ways of communicating such in a crisis moment that we can actually get off the ignorance of sepsis.
Are you well supported?
Yes.
You are.
Yes.
The authorities, the health authorities, understand that it is important that the message gets out and that you have the skills. It's not a clinical skill; it's a journalistic skill to get the message out there. That's very good.
Yes. Actually, the support came at all levels, both from the regional delegates and also from the hospital authorities. They gave the go-ahead for us to actually carry out the campaign that we wanted, because it was both online and offline. We did the campaigns online with flyers. We did it on our social media handles. We did it with influencers on social media, who had great followings, and it actually pulled the population back. We had drastically reduced in terms of consultation a week, but now we can have close to 1,000 people consulting. If you compare it to 2 years back, we would have 200 people but it's a regional hospital.
Yes.
And we are expected to consult at most or at least 1,000 people a week if we say that it is small. But we had these people not coming, and we had the mortuary getting full, and we did not have where to keep corpses. So it became a point of concern to me first as an individual, seeing people just dying the way they're dying, to now bring out these messages to see that the population is sensitized. We did it through sports, we did it through micro programs, we did it through radio drama. We did it was a whole package.
Brilliant.
And we saw that it greatly helped.
Joachim, when did you first become aware of sepsis? You're still a very young man, I can see, but
Yes, do you ask me? Oh,
yes.
sorry. Oh, sorry, Mikey. Yeah. Oh, of course. I heard about sepsis a couple of years ago. Actually, I didn't notice the problem we have, the public health problem.
How did you find out about
it? Just by reading.
Oh, right.
Just by reading scientific papers, actually, scientific and medical journals, and I learned that it's a real big public health problem. I never get experience with the disease in my daily life, in my personal life. So I had no experience with that. But I think one part of the problem is that I've never been at a physician in a physician's room. So as a man, we have the problem going to a physician and to a doctor, and even the general doctors, they never mention sepsis when you enter the rooms in a practitioner. You never get information about sepsis, and that would be that is one point. Katelyn mentioned that she used the word trusted voices, and the trusted voices are the physicians, the professionals who really got in contact to the people, and they are the trusted voices, and the most important trusted voices, and they should be informed. And my guess is that there is a lack of awareness, even in the medical sphere. So I would first try to sensibilize the young physicians, and of course the people in the clinics, and then of course we as journalists we have a real responsibility to cover this subject. But of course we have limits. Obviously we have limits. The problem we discuss right now, we discuss this non-awareness of sepsis is because the general media, the classical media, they have a problem educating the people. They just they talk about tragedies. They talk about you mentioned it, really prominent cases. But of course, people it's too far for the people to get really aware.
It doesn't sell newspapers.
It doesn't sell newspapers, so
we have to make a way to do that. Katelyn, I'm interested in your personal experience in terms of becoming aware. You know, everybody here's kind of been on a personal journey of late discovery of sepsis. I'm interested to know what influences have brought this subject onto your radar screen.
Yeah, I was hoping you wouldn't call on me because I think I have a pretty embarrassing response. But I mean, I knew sepsis. I knew what it was. I knew it could be deadly. I had no idea how common it was. I'm learning a lot just being on this panel. And I will say, I actually had a coworker pass away because of sepsis. So I know that it's there. I had just had no idea the prevalence of it. And that's from someone in public health. And so I think that we all need to be better educated about this. And there's different avenues to do that.
There are some simple things that you can do, namely, you know, in waiting rooms and emergency departments, just posters
Thank you.
old-fashioned, non-digital, stick on the wall posters. And we've managed to get that out there on in ambulances and in any A&E accident and emergency ward you go into, you'll see posters on the wall now about could it be sepsis? These are the symptoms. Just ask. And there's some simple things that can be done, I think. But what I'm getting, and I'm looking at Ning and Naoyuki here, there seems to be, apart from Japan, which seems to have made more progress than any of us have seen in our territories, there seems to be a common story here about lack of awareness and the lack of a central strategy to get the word out there. Whose job is it to get the message out there? And let me come to Naoyuki, and then I'll come to Ning if I may. Naoyuki, whose responsibility is it in the health system in Japan to get this message out there that sepsis is a very dangerous thing and easily recognized and quite often easily treated if it's seen earlier? But somebody has to own that message, and I don't know who it is.
Thank you very much. Japanese insurance management and Japanese health management by maybe, as you know, Ministry of Health, Labor and Welfare manage Japanese insurance and Japanese health, including sepsis. However, their main concern is about tuberculosis. Tuberculosis patient is Japan have newly 15,000 every year. However, not high rate. However, as you know, Japan is elder persons society country, and now the elder becomes the number of the elder person high.
Yes.
They can be easily suffer from tuberculosis. The Ministry of Health, Labor and Welfare knows that sepsis is important for management. It is a very big issue, we think.
You're enlightened, very, very smart in Japan. Is the insurance system, is that private insurance, or is there a government insurance scheme?
However, private insurance, some person have.
Okay.
The national health insurance was about 30%.
It seems to me that where a country's health system has a considerable insurance element, it's in the insurance company's interest to reduce sepsis because of the costs and the claims that they will get as a result of the incident. So it's in their interest, really, to promote awareness. That's just one thought. Ning, I promise to come to you. I'm very interested to know your experience and how you came to know about sepsis and what experience you've had of it, and how you came to know about it.
Yeah, I came to know about sepsis, I guess, 3 months ago.
Only 3 months
and that's
ago?
because of just that short period. Exactly. It's just to tell you, imagine someone handling health programs on a weekly basis, not having any idea about sepsis. Then imagine a woman in the village who doesn't have time to even watch television or read the newspapers. Just imagine. So it's to tell you, sepsis is not adequately reported. That's one thing, creating awareness. Okay, now from the symptoms I noticed on social media where I read about sepsis, these symptoms are sometimes rare, But now, the problem is, given the fact that people are not aware about such a situation, they will start attributing it to witchcraft. That's where a problem comes in. Africa is not really, especially Cameroon, there are some areas where it's not really developed, and a lot of people have little knowledge or no knowledge about certain things. And now, when they start attributing to witchcraft, they start turning to using herbs or going to some traditionalists to seek for advice or something. And these people don't have adequate knowledge on how to tackle such a situation. And that's a major problem.
Yes.
Because if we say the major problem is diagnosis, if these people are not diagnosed, then that poses a very big threat for septic cases.
Yeah.
That's why we say awareness plays a great role whenever it comes to healthcare.
Yes.
And that's the reason why my station, which is Equinox TV, decided to allocate 30 minutes every week in English to sensitize the population on different health pathologies. Maybe, let's say, hypertension, cholera, malaria, sepsis, whatever. That's the main goal. That's why we think creating awareness, not just think because I have a cold, I have let's say, running nose, maybe it's because it should be malaria. No, that's why we say diagnosis is very essential.
Yeah. What we found in the UK is that it's very hard to get the medical profession's attention. It's even more difficult to get the Department of Health into. They've got 1,000,001 problems, and they don't think this is one of them. So what we've found is that in the sort of voluntary sector, a group of people who experienced or had been touched by sepsis, some famous, some influential, people from all different walks of life, some from marketing, some from business, all kinds of things, some from the media like me. We just took it upon ourselves to take the problem on and raise funds. And we have people who have been touched by sepsis. They go out and they talk in schools, they go and talk in hospitals, and we get the message out. And it's a growing army of people. And as we get more awareness, more people ring us up and say, "Oh, I had a terrible experience, this, that, and the other. Or how can I help?" And it's kind of a grassroots a group of volunteers who've been touched by it, who want to make a difference. And we've tried through our charity, the Trust, we've tried to harness that and all those skills, and we've had some reasonable success, with getting big corporates. We've been into Amazon and got them talking to their staff. If you're an employee with 2,000, 3,000, 4,000 people, there are quite a few of those employees who've been touched by sepsis, and in terms of caring for your workforce, there's an open door there. Anyway, that's one of the messages that we go. I'm going to. I think we've dealt with pretty much all the questions that have come through through the chat line. I'm grateful to people who've submitted questions. If I could just go around the panel one more time and see if you've got anything you'd like to add or endorse or say we've got wrong. Perhaps I could start with you, Joachim. Is there anything you'd like to summarize?
Yeah, I think I heard in session 13, I had some wonderful ideas from professionals and people who are really concerned with this subject in their daily lives because they have lost some family members, for example, and I wrote down one message from it was, I guess it was from Ireland, from Doreen O'Mahony. She says, sharing the message is saving life. This is the central message. Sharing the message of saving lives. Yeah. It is a positive messaging, and I think that is contrary to my duty as a science editor, is to write about the horrible disease and the diagnosis and the preventions and the therapeutics and so on, and antibiotic resistance, of course. But I think people should get some positive messages, and if they are aware, if they can get aware of saving lives by thinking about sepsis and reading about sepsis and asking the physicians about sepsis, then I think we get some progress in the public, in lay people who are not really educated about this big public health problem.
You raise an interesting word there, educate. There are some people who might think that we need to educate journalists. I think that's an impossible task. What you have to do is excite journalists and find an angle and find a story. And that's a particular journalistic skill, which no one would expect clinicians or academics or researchers to have any idea. It's a whole different world. Pedmia is an expert, and she's grabbed it by the horns and is running with it. But she's a skilled. She knows how to get the message out. It's not a question of, you only educate journalists through stories, don't you? Through getting them interested in writing about it, because there's an angle that will get them column inches or get them on the first page of the online newspaper and so on. Do you agree with that, or do you think we could do more to train journalists? I'm not sure who's going to do the training. Joachim, what do you think?
Yes, I agree totally. I think it's a way to sensibilize journalists on the subject, and really we need not just awareness, and we also need education of the people who are writing on this, and who are writing the right thing, who are precise on educating people and explaining the problems with sepsis, and the lacks of really the lack of awareness, and the problems we have in dealing with this horrible disease.
Katelyn, can I come to you and ask for any observations? You're not a journalist, but you're in this field generally. You have a lot of experience and a lot of contacts. What do you take from the discussion and the exposure?
So I completely agree with Joachim. I think that we need to move from a model of not wanting clicks, but move into a space of, it's called solution journalism, where you recognize that there's a problem, but you grab people's attention by saying, hey, there's actually solutions. So people don't get too tired about this doom and gloom effect that we're at least seeing here in the United States in our news cycles. And I think that if we can change that to a message of hope, a message of that we're not helpless, that we can do something about this, and it's actionable, that will grab attention, just because you feel like you can do something and people want to do something if there's a problem. I guess I'm an optimist in that perspective.
Good. We need some optimism here. I'm going to come to Ning in a minute, but first I'd like to ask Naoyuki if you've been listening to all the problems that we have, which you don't seem to have in Japan. Is there any advice you would like to give us from the Japanese experience, which you seem to be years ahead of us in getting the message out there? What advice would you give us?
Thank you very much. We are cherish, and I think this is important. Educational system is very important for to know sepsis. In turn, doctors and co-medical study about sepsis. Sometimes years. This educational system and sharing knowledge system is important in Japan. And I want the media to focus on sepsis. On media, I said about, and I have educational system for citizens. It is very important, I think. In Japan, the fact that World Sepsis Day was established World Sepsis Day is very helpful for our force to raise awareness of sepsis. In conjunction with World Sepsis Day, we are able to plan lectures for citizens and medical case workers, including ambulance members,
Yes.
as well as lectures for doctors. Fortunately, with the cooperation of CBC radio programs, Japan have CBC radio in Tube area. I have presentations on sepsis every year for a week on program from 2012.
Is in over recent years, do you know if the death rate from sepsis, the number of deaths from sepsis in Japan is falling, or is it steady, or is it rising?
Detection number is rise. However, the management and the dead person rate is decreasing.
Brilliant.
Detection become easily in Japan.
Yes.
Maybe this is a part of the reason. Lecturing and sharing information system is important, I think.
Yes.
This week is World Sepsis Day. Hey, World Sepsis Day. Do you know sepsis? This comment is very important, I think, in Japan.
I think we have a lot to learn from the Japanese experience. I'll give the last word to Ning, who's been patiently listening, and see what do you take away from this discussion?
From what I've noticed, the countries, Japan, the United States, Germany, they're kind of, let's say, advanced as far as this situation is concerned. They have the right medical assistance. They have put in place the right system, which really makes it really easy for diagnosis to really be easy. I wish that was a case in Cameroon where diagnosis is really a big problem, because a lot of the people, the masses, are very far away from hospitals, where that's a very big problem, because that's the only place where you can diagnose if someone is suffering with sepsis or not. So I think, as I earlier said, awareness is a major goal. Though some of us can go into the grassroots, we make good use of TB stations. That's at least some people have TBs in their houses, where they get adequate knowledge of what sepsis is all about. But now, even though they get this knowledge, how then do they get themselves diagnosed? How then to tell they are suffering with this problem? That's a major constraint. And we hope with time the Ministry of Public Health be able to build more hospitals and put it at the disposal of these masses who are in need of good health. It often said knowledge is power. So if they have an idea of what sepsis is all about, then it go a long way to reduce the high mortality rate as far as sepsis is concerned.
Thank you. Pedmia, you're an exemplar of someone who has become a champion for the message, for the health message around sepsis and obviously other things. But you're an object lesson to all of us that really individual citizens with the skills need to take the initiative and do what you're doing with the skills that you have to work on getting the message out there. It shouldn't be left to individuals, but I salute you for taking up the cause and working so hard to get the message out there. Is there anything you'd like to share with us about what you've heard?
Okay, thank you very much. I also joining to say that we have other countries who are advanced, but I think that let me align with Joachim when he says that journalists need also desensitization,
Yeah.
because it is very much important for them to know what they want to tell the population.
Yes.
If they do not know it, how then do they even pass on this information? I also hold that journalists can hold panel discussions on radio, on television with key stakeholders who can actually, or resource persons who actually have the knowledge that the population needs. Because we must begin from desensitization. If they do not know it, we will just be ranting, and we would be making no sense if the population actually only hears sepsis and doesn't actually know what it is all about.
Yeah.
I also hold again that we must produce content, educative content for the mass media to consume. Now, these contents must come per the localities, which means that I cannot go to Yaoundé, which is the capital of Cameroon, and I'm producing content in the English language. Majority of the people there are speaking French language. So I must look for people who understand even the local languages spoken in Yaoundé, the small ethnic groups which are there. What are their languages? How can we translate the messages that we have into these languages so that these people actually understand it? Journalists must also go beyond the aspect of reporting just the normal illnesses and diseases that we know. They must go and carve a niche for themselves in things that people do not know and dig deep and bring it out so that people actually know it. Imagine Ning just knew about it 6 months ago. I knew about it just a year ago, but it is something that has been existing, which means that what about the layman who doesn't even know anything about it? So we as media practitioners must also learn more. If we are watchdogs of the society, then we need to really watch the society. What do these people not know? How do we let it out for them to understand it? What measures can we as practitioners take to be able to let these people adhere to these things that we are telling them? So I think that is what I can conclude on. And as a good communicator, we must learn to appeal to the audience that we want to meet, to the audience that we want to pass across our messages, just so that the messages is receptive and is also understood by the receiver. Thank you very much.
Thank you. Well, it remains for me to say thank you to Joachim, to Katelyn, to Naoyuki, to Ning and Pedmia for contributing greatly to a difficult discussion about how to get the message out there. But I hope our listeners and viewers and Zoomers from all around the world will have heard what we've said. I'm sure they share a common concern about getting the message out there and the different experiences. I think we should all go to Japan and find out how they've done it, because they're obviously ahead of the game. So on all your behalves, let me say thank you to you, and thank you to everybody who's been listening and watching. Good night, good morning,
Thank you.
good
Thank you,
afternoon,
Michael.
whatever.
Thank you.
Bye.
Hello, Ning.
Thank you, bye.
Very much.
Oh, and thank you to us. Thank you to the Congress sponsors, without whom,
Thank you.
without whom. Thank you.